When most people first develop hard flaccid syndrome, their attention immediately goes to one place, the penis. After all, that's where the symptoms are. A semi-rigid, flaccid state, changes in sensation, erectile dysfunction.
So it's natural to assume that the organ must be the problem. But what if that's only part of the story? Over the past few years, researchers have begun looking beyond the penis itself. Could hard flaccid syndrome involve more than just local penile tissue?
While we still don't have all the answers, recent research suggests the condition may be far more complex than initially believed.
In this video, we'll explore what the current evidence tells us and why many researchers now view hard flaccid syndrome as a condition.
That may involve multiple body systems, rather than simply a problem of the penis alone. What makes people think it's a penile problem? The assumption makes perfect sense. For many patients, symptoms begin shortly after a sexual event. This might include vigorous masturbation, sexual intercourse, prolonged erections, or what feels like a minor injury to the penis. Soon afterward, the penis no longer feels the same. Many describe a semi-rigid, flaccid state. Others notice coldness, numbness, altered sensitivity, penile retraction, weaker erections, or discomfort. Because these symptoms are centered around the penis, it's easy to conclude the injury and the ongoing problem must also be located there. In medicine, however, symptoms don't always reveal where a condition originates.
For example, irritation of a spinal nerve can produce pain far from its source.
Likewise, dysfunction within the nervous system can alter blood flow, muscle activity, and sensation. This is one reason researchers are exploring whether hard flaccid syndrome involves more than local penile structures alone.
What does the research show? One of the most consistent findings is that hard flaccid syndrome is not limited to penile symptoms.
Patients frequently report pelvic pain. Others develop urinary symptoms. Some experience pain while sitting. Many describe tightness or discomfort in the pelvic floor.
Others report changes in ejaculation or persistent pelvic muscle tension.
Psychological symptoms such as anxiety, fear of permanent damage, hypervigilance, and emotional distress are also commonly reported.
Importantly, this does not necessarily mean psychological factors cause hard flaccid syndrome. Research suggests they often develop alongside the physical symptoms.
Psychological distress may also influence how physical symptoms are experienced over time. Together, the evidence suggests hard flaccid syndrome may involve interactions between the penis, structures, nerves, muscles, and blood vessels. These systems also interact with the nervous system. Exactly how they work together is still being investigated. Why has the nervous system gained so much attention? One reason is that it controls nearly every function affected in hard flaccid syndrome. The nervous system regulates penile sensation. It also controls blood vessel diameter. It coordinates erection and detumescence. It also regulates pelvic floor muscle activity. The nervous system constantly balances the sympathetic and parasympathetic divisions of the autonomic nervous system. Several researchers have proposed that, after an initial trigger, abnormal sensory signaling may develop. This altered signaling could influence autonomic function and pelvic muscle activity, potentially contributing to persistent symptoms.
One proposed mechanism involves activation of a pelvic reflex that increases sympathetic nervous system activity.
According to this hypothesis, excessive sympathetic activity may contribute to increased smooth muscle tone,
altered blood flow, and pelvic floor guarding.
It's important to emphasize that this remains a hypothesis. more clinical research is needed to confirm these mechanisms in patients. Why don't some people recover quickly? If hard flaccid syndrome were simply a small injury to penile tissue, healing might be expected. Yet many patients report symptoms lasting months or even years. Researchers don't yet know why this happens.
One possibility being explored is that abnormal nervous system signaling may continue even after the original trigger has resolved.
Similar mechanisms have been described in other chronic pain conditions. Ongoing symptoms may be influenced not only by the initial injury, but also by changes in how the nervous system processes sensory information. At present, we don't know whether this explains every case of hard flaccid syndrome.
However, it offers one possible explanation for why symptoms may persist. Despite the absence of obvious structural abnormalities on routine testing.
The bigger picture. So, is hard flaccid just a penile problem? Based on current research, the answer appears to be more complex than that. The penis is clearly involved, and for some individuals it may be where symptoms first begin. But the available evidence suggests it may also involve the pelvic floor, autonomic nervous system, and sensory nerves. Research also points toward vascular regulation and psychological responses that develop alongside a chronic physical condition.
Rather than an isolated injury of the penis, many researchers now consider it a syndrome.
A syndrome is a collection of interconnected symptoms that likely involves multiple body systems. Exactly how those systems interact remains an active area of research. Although many questions remain unanswered, one thing is becoming increasingly clear. Understanding hard flaccid syndrome requires looking beyond a single structure.
It means considering how the penis, pelvic region, and nervous system may function as one integrated system.
As research continues, we hope this broader perspective leads to better understanding and more effective treatments. Every new study helps expand our understanding of this complex condition.
We'll continue exploring the latest research and evidence-based insights into hard flaccid syndrome.